The Effect of Muscle Fatigue on EMG Amplitude by Patrick Mertz. Muscle fatigue occurs in all muscles over extended periods of muscle activation. Muscle fatigue can be defined as a decline in the ability of a muscle to generate force. One study by Ortengren et al. Showed that muscle fatigue can lead to increased injuries in manual labor workplaces such as assembly lines. This is a very real application of muscle fatigue, causing a considerably higher chance of injury for workers. We can look at electromyographies, or EMGs, to measure the amplitude of a muscle's contraction. From these readings, we can determine if a muscle is fatiguing by seeing how much it is being stimulated. This bleeds directly into our purpose and hypothesis. Our research question was, does fatigue have an influence on muscle force and EMG amplitude? EMG amplitude was recorded over a period of time during which we told the participants to complete a 25% peak grip force isometric contraction on both their flexors and extensors. It was hypothesized that as muscle fatigue increases, the force will remain the same as the EMG amplitude increases. For our subjects, 8 total participants were recruited from the Regis University Doctor of Physical Therapy program. 5 of the recruits were male and 3 were female. The male average age was 26, the female average age was 22, and the whole class average age was 24.5. Inclusion criteria included fit and willing individuals, so someone that was willing and prepared to get their arms shaven and EMG recorded, and exclusion criteria included any type of heart condition. Initially, EMG electrodes were placed on the forearms of the dominant hands of the participants, but this was done after their arms were cleaned with an alcohol swab and shaven so that we could get accurate results. The electrodes were then tested to make sure they were placed properly, and the dynamometers were adjusted to each individual. Participants were then instructed to complete a maximal grip test, so this means they squeezed the dynamometer as hard as they could. From that, we were able to calculate 25% of their peak grip force. They were then told to hold this level at 25% while EMG and force measurements were recorded every 15 seconds up to 300 seconds. For statistical analysis, percent standard was calculated for force and EMG values. Mean and standard deviation were also calculated for each participant. In our results section, we can see the graph that we got from our results. Our data showed a slight positive trend in the standard EMG amplitude as time went on. The mean peak force and mean time to fatigue are also listed there. On our graph, the extensor muscles are represented by the green line. They started at 58% standard muscle activation, lowered to the 40s, and hit as high as 72%. The flexors are in blue, and they also slightly increased from low percents of 36 up to 55% of standard muscle activation. While this is not a strong correlation, it does have a slight positive skew as the numbers slightly go up over time. For our discussion, we can talk about what these results actually mean. So our results backed up our hypothesis that EMG amplitude would increase as muscle fatigue increases. This makes sense as what we've learned in class because we know as muscles fatigue over time, our brain actually sends signals to recruit more muscles for activation to keep up with the increasing demands of work. Rogers and Dawn did a research study that looked at similar resources such as ours. He found that a main reason for increased EMG signals is increased motor unit firing and increased motor unit recruitment, which can be seen by the heightened activity in the EMG. As stated in the introduction, we know many muscles used in heavy work fatigue after long days and significantly increase the risk of injury. So this is how we're going to bring this into clinical relevance here. These are very helpful because knowing how muscles fatigue over time can help clinicians in determining which of these movements are causing the most fatigue for individuals. Informing the patient on how to prevent these strenuous movements can help reduce their chance of injury. Now, I realize that, for some jobs, manual labor is a part of it and that's going to happen. But I feel that if we can better help inform our patients of these injuries and how once they get to that fatigue level, their percent chance of injury increases so much. If they can explain that to their bosses, perhaps they can try to find better solutions of how they would be able to prevent these injuries from happening in an everyday workplace. Overall, in conclusion, our hypothesis was correct that as muscle fatigue increases, the force will remain the same and the EMG amplitude will increase.